So our next item on our agenda is proclamation for Public Health Week. And I want to start off by saying that last week at our Joint Powers meeting, we were discussing I know we do a deal coming up for fire and all that stuff in May where there's Fire Week. And we learned of the National Public Health Week is this week, and what a better time to recognize those from our county public health department for the incredible work you've done this year. Just extraordinary and so a year ago so unexpected, and to step up to the plate, and what we're hearing constantly is the number of vaccines that you're now doing on a weekly basis is incredible, and it's getting us that much closer to getting back to some form of normal reality, and we couldn't thank you enough. So anyway, we have this proclamation, and it's from our county board and also from our Joint Powers group, which includes the City of Moorhead, the City of Dilworth, Moorhead Public Schools, and Dilworth Public Schools. And we're all sharing together in this proclamation, but I've asked for each member of our board and Steve to read a portion of it on behalf of all of you in our county public health. So Steve, do you want to start?
Certainly. Whereas Clay County Public Health is the practice of preventing disease and promoting good health, and
whereas since 1969, Clay County Department of Health has provided public health services to the residents and visitors of Clay County, and
whereas Clay County Department of Public Health educates and engages residents and community partners in order to become among the healthiest counties in Minnesota, and
whereas strong public health systems are critical to sustaining and improving community health, and
whereas Clay County public health workers deserve special recognition for their service, for the tremendous job they do, especially during the past year with the COVID-19 pandemic and difficult circumstances that they have faced, and should be recommended or commended by leaders in the profession, the public, and our elected officials.
And whereas Clay County Joint Powers Committee, which includes Moorhead Area Public Schools, Dilworth, Glendon, Felton Public Schools, the City of Moorhead, the City of Dilworth, and Clay County, is recognizing those in the public service they provide to our communities. And now therefore, the Clay County Joint Powers Board do hereby proclaim April 5th through the April 11th, 2021 as Public Health Week in our county of Clay in the state of Minnesota. And again, I want to thank you, and I believe we might have some others that wanted to speak. Do we have anybody online?
Shelley, are you there?
Yes, I am.
Okay. Oh, good. Mayor Carlson.
Thank you for giving me the opportunity to thank all the public health workers for their tireless work this past year. I really appreciated the Clay County Commission declaring this week Public Health Week, and appreciated the opportunity to sign on to the proclamation. The City of Moorhead and its citizens would not have gotten through this year without that tireless and endless hours put forth by the public health nurses. So thank you very much, and I hope they enjoy the wonderful week.
Thank you, Mayor Carlson. Oh. Yeah, so the last paragraph that says, in witness whereof we have hereunto set our hand and jointly signed as the representatives of our agents, each agency of the Joint Powers Committee in Clay County. And so this is signed by Brandon Lunick, the Superintendent of the Moorhead Public Schools, Mayor Shelley Carlson, Brian Tygeson from the Superintendent of Public Schools, and Mayor Chad Olson from Dilworth, and myself as the County Board Chair. And I think now after reading that, I think we should just we have a lot of public health people here today, and I think we should give them a big round of applause. All right. And I went and wrote on this thing that we had all our original signatures on, so. So I'm bad. All right. Yeah. Yeah, we can fix that. Anyway, I would like to make Colleen's job difficult, I guess.
Do we need
All right, so,
a motion on that, or do we?
yes, yeah, let's have a motion to approve that
I'll
proclamation.
make that motion.
Second.
Okay, Commissioner Gross, second by Commissioner Kaylee. All in favor signify by saying aye.
Aye.
Aye, opposed, the same, motion carried. And once again, thank you, and Kathy, it's your turn. Speaking of public health, we've been fortunate to have you come to us on a weekly basis to give us our updates and continue to provide important, necessary information to our citizens as we go through this. And Jamie here with you has also been very helpful. So welcome once again. And what's new on the COVID?
Well, thank you, Mr. Chair and Commissioners, and appreciate that recognition of, and Steve mentioned Public Health Week. Jamie and I were like deer in the headlights. We're so involved in COVID, just completely didn't remember about our Public Health Week. I just wanted to note some of the team. You see Jamie and I every week, and some of you have seen some of the Cheryl and some others at the vaccination site, but this is the group that makes everything happen.
Can we have them this morning? You brought them here. Can we have them just come up one at a time there, and maybe you can introduce them to us?
Sure,
And for the
absolutely,
public. I think
yes.
they deserve that recognition before we get started.
And of course, there's others back at the office.
Yes,
that
well,
couldn't
but the
make
ones
it,
that are
and
here,
The whole public health department gets involved, so everybody in public health has had some role
right.
in
But
the
I
pandemic
think,
response.
I think we
but-
should see them today, and
And you remember Cheryl Sapp, who was
Yes.
initially with us, presenting information and updates. And of course, she is our key manager at our vaccination pod, and she is in charge of all the storage and handling of the vaccine, and she gets involved in many things in response. So whatever is needed to be done, she does it.
there's
So
not many county employees I would allow to stick a needle in my arm. But Cheryl, she was one of them, so.
she's a good shooter.
All right, well,
So-
thank you very much for all you've done. Thank you. Who else do you have here?
And Terry Bush is one of our public health nurses, and she's been involved in the response as well, again, doing lots of things, but really in charge of essential services that we've needed to provide out into the community. And she's had some other roles, but I forget what they all are. There's lots of them. And now, on top of a pandemic, just to note that we have active TB. So now Terry's going to manage that as well. Like, we have time to do that, but it's our job, so. That's right.
Well, thank you very much. You must have, I see a couple more here.
Yeah, Josh is. And Josh Ebert is, of course, our emergency manager. He's the key in making everything happen, and planning and organizing and connecting. He's part of our incident command team. He's instrumental in what we do, and of course, he has to write all the reports for MDH. So he's got a really big job. So he's a key for what we're doing in public health in response to the pandemic.
Thank you, Josh.
And Becky Schmidt.
You didn't know you were going to all have to have a speech.
Yeah.
You said I'm making this go to.
Sorry, guys, I didn't know you were coming all up. Becky is, actually, she's with our food pool and lodging and she works with Kent, but she has epidemiology background, so we have pulled her in. She was involved initially with all the case investigation, contact tracing. She is doing a lot of our data information. She's, working with public information officer. So she's doing a lot of things in addition to her work with all the food pool and lodging establishments. So we appreciate her expertise in this. Thanks, Becky.
Cool, thank you.
Or Rory, what's your name again? Rory, yeah. Rory, oh boy, what can I say publicly about Rory? It's on the public, I'll be careful. Rory has been instrumental in, of course, as you know, with throughout the whole pandemic with getting a location for people to be isolated and quarantined, especially the homeless and other populations. So he's worked tirelessly on that and independently on that, and also working with all the diverse populations, the shelter, all of those things, and so whatever beyond his work as a health promotion director. So he's been very involved. He's part of our incident command team. So whatever we ask of him, he's always willing as well.
So Kathy served on our CARES committee, and one of the things, Rory, that you were very helpful with in that process is you did an awful lot of research on our behalf in terms of where are some of our good places to help the community in terms of using those dollars. So thank you for that as well. You were helpful. Thank you.
And he's also worked with, of course, the Fargo side as well, so as a segment of that Red River Valley Task Force. In fact, most, if not all, of the individuals are on our Red River Valley Task Force. Rory has worked with a particular segment, particularly with the diverse population, so it's been great.
All right.
Thank you. And Jason McCoy, who will be also presenting today on another topic, but he has been pulled in also as well, working with public information in other areas that we need him in. So he's been, also looking at data and participating in some of our phone calls with MDH that we can't always get to, so providing the information in regards to that, media updates. So in addition to the other work he does, he's been pulled in to respond in this pandemic, and so we appreciate all of that. Thank you.
Right, well,
and then there's many others.
Yes, and be sure to
Yeah, okay.
recognize all the rest when you go back. It's
Yeah.
it's nice to see faces even though they were masked, but it's
Yeah, this is the team.
yeah, excellent team.
If we didn't have the team and then the others that couldn't be here and all of the public health, we couldn't have made it. We started in January planning our response as we were hearing about what was coming. So this is the team that made it happen. They get the accolades. So yeah, thank you very much.
Yes.
Thank you, team. Okay. Let's see, I guess we have to give some data. I sent some last week as well when we didn't have a board meeting, but as we look at the numbers this week, you can see that we are increasing with active cases, which we kind of had predicted a bit, especially with, some of the events going on. We have, sporting events, we have spring break, we have gatherings that are occurring, and so we're seeing an uptick in active cases, and we it's kind of across the many states and across the United States. There's a concern about the uptick. So that's happening here. So we're following that. It's increasing our work for our case investigators and contact tracers. So we're glad we have those individuals on board. As you note, our 14-day case rate also went up a bit. From 25.96, it's now at 29.95. That would be understandable based on the number of cases. And we're still seeing some increase in cases, so we'll be seeing this it's kind of been on the rise for a few weeks, so we anticipate it's going to continue a little bit. So because of that, we really still caution people. We're still in the midst of the pandemic. We still have it's circulating. We don't have the entire population vaccinated, so we don't have that herd immunity. We need to continue with our masking, our social distancing, and all of those things. Unfortunately, there's been a little bit of a lax as they're seeing across the nation. So we're trying to be very vigilant about that. We do have the variant strain that's circulating, and I mentioned that they did have the first case in Minnesota, but we have now a lot of it's the United Kingdom variant strain, the B117, and so it's now across all the states. Minnesota is one of the higher ones that have been detecting this strain. I think they're third highest so far, but as they do more testing, they'll find a lot more of that strain circulating. What they know about the strain is it seems to be a bit more contagious than the initial one. So it's going to be a little bit unpredictable how that will play out. But because of that, we need to be vigilant in what we're doing. So just a note on that. You see the active cases on the second page, and for this week, it's the 20 to 24 that's at the highest level. The previous week, we were noticing more the 15 to 19-year-olds and the 40 to 49-year-olds, but and that's going to vary every week as we look at our active cases. And cumulative cases are really pretty steady. And then we see our hospitalizations. We're still 89 deaths, which has been the same. In Minnesota, they're seeing a little uptick in the hospitalizations. And they're seeing that in other states as well. So that's a trend we're going to be watching. We meet with the Red River Valley Task Force tomorrow, so we'll find out what's been happening locally in our hospitals. Any questions on that before Jamie starts?
Commissioner Moore.
Thank you, Mr. Chair. My question had to do with hospitals and capacity, and thanks for stating that you'll find that out more tomorrow. Over the course of all of this, it seems to be, we saw a large amount of our deaths with those higher risk older populations. And just looking at the graphs that you provided and seeing that at least 72% of our older population has been vaccinated in with at least one dose. It seems to be that that's really slowed the deaths that we've seen, as we haven't seen a death since the beginning of January. Are you, as we move out of this, whatever that looks like, in similarity to how we've lived with influenza, is that kind of what you're seeing, that even though we'll get some form of vaccinations, we'll still see COVID positivity rates going forward? It just will be how severe it affects certain populations. Is that kind of where we're coming out of this, from an uneducated public health person?
Yeah, yes, thanks for that question, Commissioner Mojo. They are looking at and doing some studies on when will the booster shot be necessary, and what's the time frame for that. So there for sure will be, whether it'll be annual or more often than that. They haven't completely finalized that as they're studying, but you are correct. They believe that this will be around and it will continue to need a vaccine for that. And of course, they're working on vaccines now for the adolescent age. Right now, it's 16 and over, but they're working on a vaccine for the adolescents to reach those.
And I think, like you say, people are becoming vaccinated and they're still being careful, but there are activities that are now happening more than they were in November when we had our spike. And so in many ways, even though we're still seeing positive cases, it's maybe much less because people are more out and about. And so I'm not saying that we need to not be careful anymore, but I think we're learning how to maybe live with it. And I hope the trend with more people getting vaccinated continues, but we'll be curious to see. Hopefully we can keep the deaths at zero going forward.
Yes.
Just to follow up to that too, I know there's a county employee who's mentioned that they actually know of somebody who had both shots and it was past the 14 days and they've now tested positive for COVID. So it does happen. It can still happen. I think when those things came out, we were told that they might be between 90 and 95%, effective in a good way. I don't want to scare anybody by any means. The one good thing is I think currently anybody who's been, for lack of a better word, reinfected with it, I don't think that there's been any signs of hospitalization involved with those. So at least that's a plus. So that in the worst case scenario, if you did get it again, it's probably helps from it being too severe. So I still encourage people to get those shots.
Yeah, thank you, Mr. Chair. I know Becky has talked about even having some conversations with a few that have been reinfected as well, so it's happening.
So it does happen, and that goes to Commissioner Mojo's comments too, that, we still have to be cautious, but hopefully still in a more comfortable way than what we had to go through this past year. Okay, Jamie, you want to talk about vaccines?
And I'll add to that too. We have that conversation every year during flu season because people will start saying, oh, it's only 40%, but the issue is, and when you have your flu vaccine, it does prevent you from being as ill. And so it will be the same in this scenario. If you are ill, hopefully you will not be as ill as you would be if you were not vaccinated. So I think we just have to keep reminding people that it's not 100%. There are always exceptions, but you can do what you can to protect yourself and those around you by vaccinating and following those public health practices. Okay, so on to vaccine. We have moved to the point where we are now serving 18 and over, and we say 18, not 16, because we don't have the Pfizer vaccine in public health. And so we are encouraging people to sign up to receive a vaccine. And so I just wanted to note that that is on the website, the county website. And what we do is we export those to send you a link to register. So encourage people to sign up, because that's where we draw from to get people signed up for the next clinic. We are averaging about 1,000, so we were just over 1,000 vaccines that we administered this last week. We've moved to the point where it's more of a challenge to get the vaccine used than it is to get it. And so that's kind of a new change for us. The big challenge, and I know Kathy's talked about this, but I just really want to stress that the 72-hour requirement of the governor is really what the challenge is. So what that means is we plan for vaccine clinics, but we don't get our vaccine until Tuesday, which means our clinic's starting today at 11. We have to wait till our vaccine arrives. And then we have to use it up within 72 hours. And so it's not very flexible for the community. And so that's the challenge because of that flexibility for the community, which is what we want. So we are constantly calling people and saying, can you come in for vaccine? So a lot of staff time is going into calling people to get them to come in for vaccine because of our 72-hour requirement. So
Jamie, if I can interrupt just for a minute. So I'm assuming that other counties might be experiencing the same thing. So what's the State Department of Health? Are they trying to encourage a change from the governor in that 72-hour?
Yes, and I can say that Kathy's reached out to all of our legislators. She's passed the message up the chain. I think sometimes it's just difficult to understand what the barrier is because it's not about the speed. It's about not having access. That's the 72-hour. We're able to carry 10% of our vaccine over into 7 days. So that gets us to Tuesday, the next week. So we've got a little bit to work with on Friday and Monday, but it's only 10% of that vaccine. And so that is not a lot. And again, the point I just wanted to make is it doesn't make it as accessible for the community when we have that 72-hour requirement to get the vaccine used in that time frame. So sorry, I got a little sidetracked, but I just wanted you to be aware of what a challenge it's creating for our staff and for the community to use that in that short period of time. But we continue to meet the challenge and we continue to use every dose of that vaccine. And again, a lot of time and energy is going into in the evenings and calling people, and we have lists of people that are waiting, but we need to get them there because the vaccine, and that's what's unique about this vaccine, it has a short window of once you've got that vial open, that it can be used. So it is time-consuming and a challenge to meet that requirement, but we've met it every time. Okay, so back to the stats.
Before you go on, we
Really
have-
quickly, I noticed last week, it must have been similar to a situation where you're talking about where you had some that needed to get used. And I noticed that you forwarded it to some of the organizations that we partner with to send out to staff. And I think there are larger employers in the community, the county, that I think that will probably continue to be something that's beneficial for you to do, to get the word out, to continue to use all of the doses that we have available. But we will continue to advocate for more flexibility on that 72-hour. I think you're right, it stifles the opportunity to make sure we get that out. And it's too bad that it's a hindrance, but thank you for the continued good work on it.
And I think as we're, for the public to know, I do know that some of our pharmacies now in the Moorhead area are also offering vaccines, and some of them have been able to get the Johnson & Johnson one, which a lot of people like, the one and done type of thing, but
Right.
so, if they can't go through public health through an appointment here, I would still encourage them to call their local pharmacy as well as another opportunity to get the vaccine, and especially as it's opened up now to more ages, so it's just another, and I know, I don't know if there's pharmacies in Hawley or Barnesville or whatever, but I would still encourage people to try to call those local pharmacies and see if they have that opportunity as well, so. Okay, Jamie, you can continue.
That sounds good. Okay, so looking at our data here for this week, the total number of people with at least one dose of vaccine in Clay County, 33.8%. Minnesota, 41.1%. Total number of people completing this vaccine series, 22.4% of Clay County population, and in Minnesota, 26.4%. And the people aged 50 to 64 with at least one dose, 42.4 in Clay County and 43 in Minnesota. People aged 65 and over with at least one dose of vaccine, 17.3% in Clay County and 82.5% in Minnesota. And then the total number of doses that Clay County Public Health alone has administered to date is 10,897. And we do look at the total number for the county and kind of scratch our heads because it seems like there should be more. And we all believe that there are more people vaccinated because they're getting vaccinated on the North Dakota side and have other opportunities. So we truly believe that number for Clay County should be higher, but we don't have the data to back that up.
So as I just mentioned, the local pharmacies on the Minnesota side, do they report those counts to the state, which get?
They're not required to do that. They report it at the federal level, and then the federal is supposed to come back to the Minnesota level. But we do not have that information.
So that 16,000 number in Clay County might not include some of those then as well.
It's supposed to, but yes, we believe that it probably doesn't.
Commissioner Moser.
Jamie, how does that, and maybe Cheryl can answer this better, but what does the Clay County Public Health yearly give in influenza vaccines? I mean, what's the number?
She also gave me that one.
Same.
So generally, and this is pre-pandemic, of
Right.
course, we usually give anywhere from around 450 to 600 doses of influenza, and of course, that includes pediatric as well, because we get state vaccine for children as well. So this past year, we did not give nearly as many influenza vaccines, but again, the good thing is if you look at the statistics for influenza for this past year, because people were social distancing, masking, staying home more, influenza rates were way down.
And I think I'm appreciative that you have that number because it's important for the public to realize that you've given 10,897 doses in the first quarter, a little more of this year. It's enormous.
It is.
Just one comment, Mr. Chair and Commissioners.
Yes.
when Jamie talked about, we give every dose out, we haven't wasted a dose. And we've worked really, really hard at getting that out in 72 hours, so we can meet that requirement of 90%. But Cheryl's been the key, because she will stay until the vaccine is gone. So she'll stay till 6:37 at night to make sure that we don't waste a dose and the vaccine is given, and without complaining. She's just always willing, throughout this whole pandemic, to make sure that we get those doses out, and calling and trying to get people over there. So she's been working really.
Yeah, I agree with that, and I think you've even had a couple of times where, it seems to me, didn't you have some after-hour openings too for, I think when you were giving the vaccines to some of the educators,
So generally, with the Moderna vaccine, it comes in a vial of 10 doses. And if we have a person that is late to their appointment for our clinic over at the Yum Comps, we'll have to open a vial to give them their dose. Well, that could potentially leave us with 9 doses left. And in all good conscience, as a public health nurse, I cannot waste anything. So we have tried to create lists for people that have called public health and said that if you have any extra doses, there's been times at the Yum Comps when we've had up to 25 people waiting at the end of our clinic to see if we have them. But because the opportunities have increased with healthcare systems and pharmacies, and allowing people to have more options to get their vaccine, those lists are dwindling. So I may have Kathy call each of you if you know of people who haven't been vaccinated and would like to be, if we have those doses left over.
very good.
And that's good news, because it's getting to be a challenge. We had people that were waiting, and we have a team that puts that list together, but the good news is it's become a challenge for us to use those doses, and it's time consuming and stressful, but it means people are vaccinated, so that's the number one thing.
Do you want to continue, Jamie, or were you
I think I'm good.
wrapped up? I'm just trying to,
I have
I'm just
one
trying
other-
to, cooperate with Frank.
one
here.
other question, I'm sorry. Thank you. I know we've heard a lot from the governor in terms of what his threshold is for reducing some of the regulations. And as I see that on here, 26.4 of the state population has completed. What are you hearing, if anything, in terms of that?
Basically, as they're talking about relaxing things, they're also reminding people that we do still have a lot of what you already shared this morning, is that we need to be aware of the fact that it is still circulating in the community. So we're moving cautiously, but optimistically.
And Mr. Chair and Commissioner Mojo, they also have, and you may have seen that on the news, they've designated some extra state vaccination sites. So they're trying to saturate some more. I think the State Fairgrounds was just the last one. There's many vaccination sites in the metro area. So he's trying to have the ability to push out a bit more. And when he opened it up to the general population, there's so many pockets in areas of Minnesota where they were just sitting. They had no other people in those particular phases. So it was pretty inequitable. So to open it up so some areas can really kind of move forward and push through their vaccine was a good thing. So
I think, and just to follow up, I received the Johnson & Johnson and at one of the local drugstores, and I was informed by the person giving it to me that over 50% of the vaccines that have gone out of there have been to people from the metro. And so I think it's important for the public to know that Clay County citizens, that there are those doses available locally, but they're also being used by people from elsewhere in the state, which is okay. But I think that Clay County citizens should have first dibs at it personally.
So, as we wrap this up, there's something else that I want to make sure that will you please give our thank you, and this proclamation also applies to those that were working the contact tracing. I think they need to know, and then also you've had an awful lot of, I think you've brought in some part-time nurse students and what have you to help give those vaccines and make sure that you send them a thank you on our behalf too. The proclamation also goes out to them. So if you would do that for all of us, it would be great.
Thank you, Mr.
Commissioner,
Singleton.
excuse me, Mr. Chair Campbell, I also want to include our volunteers
Yes.
at our vaccine clinics. We've had a number of volunteers from retired folks to college students that have come and assisted us with making our process over there very smooth. So
Absolutely.
I want to remember them as well.
Well, they all made, are making this a lot better for us, so.
And we would be amiss, Mr. Chair, if we didn't also mention our emergency manager. So Gabe has been with us from the
Oh, yes.
beginning
Yes.
and been involved in our incident command team, and then the emergency manager from City of Moorhead has also been very involved, and of course was the one that kind of reached out about the YMCOM Center. So they've been instrumental in working right along with us, and they're a valuable member of our team.
So you're, Kathy, I remember a couple of meetings you coming in here and you were kind of stressed. And it's very nice to have you come here and report and with a nice smile on your face. And
Thank
so
you.
obviously
Yeah,
things
had my
are.
moments.
Yeah, well, yeah, but well, you all have just done an amazing job, and we just want to thank you. So.
Thank you.
And
Okay.
I get the sense that there maybe is a little bit of relief from you folks in public health. Maybe?
A little bit with the vaccine. Well, maybe Cheryl can't say that, being in charge of the vaccine. But, yeah, we're seeing some progress.
I would say we've just learned how to adapt.
All right, okay.
We have to
I'm not
laugh.
suggesting that your work isn't over, but
Yes.
thank you all very much.
Okay, thank you.
Thank you.
Thank you.